Hello, everyone. Good afternoon. Thank you so much for joining our October Choices Community of Practice Coffee Chat. Wishing you all as well a happy Halloween. If you're celebrating yourself or maybe with kids later today, we hope you have a wonderful holiday. The topic for today's event is creating healthier spaces for kids, promoting healthy eating, active living, and health equity in out of school time. My name is Molly Garrone, and I'm a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health. And as always, I'm happy to be the facilitator for today's coffee chat. I would like to take a moment to acknowledge our funders. They make this work possible, and also share that our Choices events and work are for research and educational purposes only. So just want to make a note of that, and also say that the intention of today's coffee chat is to provide information, tools, and resources to inform and educate, and we are not looking to influence any specific legislation. I also want to make a note that our guest speaker today and myself are invited to share personal perspectives and do not speak on behalf of Harvard. If you're unfamiliar with the Choices Community of Practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. So our coffee chats are kind of unique opportunities to share ideas and enhance connections in an informal setting. Today, we will start by hearing a presentation from our speaker, and then we will open it up for a full group discussion and Q&As. But please do feel free to share any questions or comments in the chat at any time today. So for today's coffee chat, we will be discussing out of school time and why it's such an important opportunity to promote healthy eating, physical activity, and health equity among children. We're really excited to hear from our guest speaker about how out of school time standards in particular can be used to support health and well-being and highlight examples of evidence-based strategies. We will also be highlighting our recently updated and refreshed materials for the out of school nutrition and physical activity, or OSNAP, initiative. So I'm really excited to introduce to you all Kate Goddard. Kate is an experienced project leader, training and technical assistance specialist, and instructional designer. She develops, oversees, and advances programs that improve the quality and equity of out-of-school time learning. Building on her experiences as an after-school practitioner, she puts youth development at the center of all of her work. Kate leads the National Collaborative for Advancing Health Equity in Out-of-School Time and is the Associate Director of Training and Technical Assistance for the Office of Child Care's National Center on After-School and Summer Enrichment. So welcome, Kate. We're really happy to have you with us today to talk about out-of-school time. Without further ado, I'm going to turn it over to Kate to get us started.
Great, thank you. Thank you, Molly, for the introduction, and so thrilled to be joining you all today to discuss out of school time. And you can move to the next slide, please. Thank you. So as Molly noted, I'm Kate Goddard, and I use she, her pronouns, and I'm a project director with the Education Development Center, and I lead our team working on the Collaborative for Advancing Health Equity in Out of School Time, which I'm here to talk more about today. But for those who don't know, the Education Development Center is a global nonprofit that advances lasting solutions to improve education, promote health, and expand economic opportunity. And so since 1958, we have been a leader in designing and implementing and evaluating innovative programs in more than 80 countries around the world. We are actually headquartered in Waltham, Massachusetts, but we're founded in Cambridge in 1958. So just wanted to plug that. And I'm actually in Santa Fe, New Mexico. So we're a fully remote team and are doing work all over the country and the world. So just real briefly, the Collaborative for Advancing Health Equity in Out of School Time is a partnership with the Education Development Center, my organization, and the National After School Association. And we couldn't do this work without the support from the Centers for Disease Control and Prevention. And we believe that everyone has a fair and just opportunity to be as healthy as possible, and are working to elevate the role that out-of-school time programs play in helping to eliminate preventable health disparities. We do this by facilitating learning, promoting the adoption of evidence-based resources, practices, and policies, and supporting partnership development. And we are one of the funded nonprofit partners that are working to support the CDC's national initiative to advance health equity in K-12 education by preventing chronic disease and promoting healthy behaviors. So all of this work is supported by the CDC's Division of Adolescents and School Health. So many of us are familiar with DASH, and includes the CDC-supported Healthy Schools grantees. And I hope to have time later in this call to talk more about them. But they are 20 state education and health agencies. Some are universities, and there is a tribal nation that are funded to implement and evaluate the adoption of the whole school, whole community, whole child framework in schools. Excuse me. And then I also wanted to share, for some of you, I do see a couple people here who are working with the Out of School Time as an Out of School Time Alliance or with some intermediaries. But for those of you whom, Out of School Time is new, I wanted to also introduce the National After School Association. So they're a critical partner in this project with us, and they are a professional membership association for people who work with and for youth during out of school time. And is the leading network of out-of-school time professionals. So in addition to a national membership network, they have state affiliates, which are out-of-school time intermediary organizations that promote quality out-of-school time programming through community building, professional development opportunities, and job quality improvement efforts. And they also host the most fun national convention that is the premier professional development event for out of school time professionals. And so this year that will be in Nashville in March. So we'll share more links and you can find out more about them, following today's call. So next slide, please. So before we begin, I wanted just to take a moment and share on the slide the definition that we use for health equity. And as I've already mentioned, we as a collaborative, we're really working to elevate the role that out-of-school time programs play in advancing health equity. And much of our work is focused on promoting the evidence-based resources, the tools and practices that lead to the policies, decisions, and program changes that increase opportunities for young people and for staff in out-of-school time programs to be physically active and have access to healthy foods, and also in their communities. So today's presentation, I will hopefully highlight for you all how out of school time is a critical partner in this work to help reduce health disparities and improve health equity. Next slide, please. And to just set the stage real briefly, I wanted to share that 7.8 million young people attend an out of school time program currently in the United States. Next slide, please. And yet, while 7.8 million youth are currently enrolled, for every one child in an out-of-school time program, 3 are waiting for an available program. The After School Alliance's 2020 America After 3 p.m. survey is the nation's most comprehensive survey on after-school and summer program demand and supply. So this data that's here on the slide is from the 4th edition of the America After 3 p.m. and provides a detailed accounting of the circumstances and conditions of youth during the hours of 3 to 6 p.m. and compares program participation and unmet demand statistics from 2020 with the results from the previous surveys from 2004, 2009, and 2014. So as you can see here on the slide, and what we know from the data is that demand for programs, for out-of-school time programs, continues to increase, and so too have the barriers for participation. And those barriers include cost, transportation, and lack of available programs. And we also know when you dig into the data and when you visit the link that's the source here on the webpage, you'll see that it also shows the barriers to participation are even greater among communities of color and families with low income and rural communities. Next slide, please. And so what do I mean when I'm talking about out of school time? I have already said words like after school, I've said summer programming, I've said 3 p.m. to 6 p.m. But really what we're talking about is a supervised program that young people regularly attend when school is not in session. So this includes before and after the school day, as well as like school breaks and summer, holiday breaks, all of those times. So that's what I'm really talking about when I talk about out of school time. And we often interchange those out of school time with after school, and you may hear me do that today as well. And I wanted just to highlight that out of school time programs are everywhere. And as someone who worked on out of school time as a practitioner for many years, I have worked in probably half of these settings in delivering out of school time programming. But I think most often people think about schools as being a site for out of school time, or a recreation center and YMCAs and kind of leading youth development organizations like Boys and Girls Club of America. But there's out of school time programming happening in your community in a host of locations. And you can see here on the slide a sampling of some of those spaces that young people are getting care and having enriching opportunities beyond the school day. Next slide, please. I also wanted just to highlight that out of school time programs have a long history of ensuring that youth have access to healthy foods and opportunities to be physically active. They have a place where they can feel safe and are engaged in culturally relevant learning activities that are purposeful and intentional, and form positive relationships with both the adults and their peers in these programs. And so knowing that we can have a positive impact on the health and well-being of youth, out of school time programs are strong partners in the system that supports whole child health and wellness and advances health equity. Next slide, please. And we also know that studies show that regular participation in quality out of school time programs leads to many positive outcomes for students. And what's here on the slide is just a sampling of those positive outcomes for students. But you can see here that by participating in out of school times, that students show more engagement in school, that they have improved school day attendance. And to me, this is one of the real pressing issues since the pandemic is chronic absenteeism. And there's a lot of evidence that's showing how out of school time programs can address that. There's also studies and research showing that it reduces behavior problems and fewer disciplinary referrals. But for someone who's worked in out of school time, to me, one of the most important roles that out of school time programs have can play in positive outcomes is really that focused on the social emotional learning competencies that young people learn in these programs, and that they have opportunities to build their self-confidence, their social skills, and really build those positive social behaviors. Next slide, please. Thank you. And we also know, and I think this room is full of experts that know that studies show that healthy, active youth learn better, that they perform better academically, and that they experience fewer behavioral problems. And still, we know that many youth do not get the nutritious food and physical activity they need daily. And so really this kind of win-win situation is here, right? Out of school time programs provide that space, they provide that flexibility, they have the opportunity to really augment what's happening in the school day to help address this need for young people to get more access to healthy foods and physical activity. And so back in 2011, a number of leading out of school time partners, including our partner, the National After School Association, worked together to develop and adopt these healthy eating and physical activity standards, which are really intended to provide practical, comprehensive guidance for out of school time programs. And the healthy eating and physical activity standards, they are evidence-based, and they translate nutrition and physical activity science into actions that out of school times programs can take to offer healthy foods, beverages, and physical activity. But they also go way beyond that. The standards also address staff training, program culture, policies, program management, and environmental issues. So note, I will say, once you start looking at the standards, and we're going to hear from Molly about OSNAP, the standards are aspirational in nature. There are 46 of them. There are 5 different content areas that I just mentioned. And so they're really meant to be a guidepost for programs to think about what are they currently doing, what do they want to be doing, and then tailor these standards to help meet their specific goals in the context in which they're delivering their programs. Next slide, please. Thank you. And so in sum, and before I turn this over to Molly to talk a little bit more about OSNAP, we do know that there are a number of out of school time evidence-based strategies that can really help advance health equity in our communities and giving both youth and staff access to these opportunities for access to healthy foods and nutrition and physical activity. And so one of those is to adopt policies to make nutritious foods available and physical activity routinely available. to partner with community organizations to deliver out of school time programs and provide that program support. I think this third bullet's really important, to strengthen relationships between the out of school time program staff and the school staff. And here specifically calling out school nutrition professionals to increase access to the food storage and to support the adoption of the standards and to provide training and professional development for those program staff. And then, of course, implement the healthy eating and physical activity standards for out of school time. And so I'm going to turn it to Molly now, who's going to share more about the OSNAP initiative, which has taken some of the healthy eating physical activity standards, has selected a collection of them, and has worked in the state of Massachusetts to really help out of school time programs put these standards into practice. And she's going to share some more about the wonderful resources and tools that OSNAP has. And I will say that we as a collaborative use and promote all the time. They're fantastic. So Molly, with that, I'll turn it to you.
Awesome. Thank you so much, Kate. So if we go to the next slide, please. It's a great segue. So I'm happy to share more about the Out of School Nutrition and Physical Activity, or OSNAP initiative, as Kate mentioned, and we mentioned at the beginning of this event as well. So for those who are not familiar with OSNAP, OSNAP is an evidence-based initiative to improve out of school time practices and policies with the goal of helping kids to move more and eat healthier snacks. And the purpose is really to identify and support lasting and cost-effective policy and practice strategies that promote increased access to healthy foods and beverages, increased physical activity opportunities, and reduced screen time in out-of-school time settings. So in that sense, OSNAP is a really great way to meet those HEPA standards that Kate was just talking about a couple slides ago. So OSNAP can be used to adopt practices and policies to make nutritious foods and physical activity routinely available, provide training to out-of-school time staff. Kate was just talking about the importance of that, as well as the focus on the connection between programs and school nutrition professionals. And then a really key piece of OSNAP that we're really looking to kind of elevate here is that you can develop an action plan through OSNAP for implementing healthy out-of-school time changes over the course of a school year. So it's a very exciting feature of the OSNAP initiative. Next slide, please. So another great thing about OSNAP is that there's a really strong evidence base for it. So several studies were conducted by many of my colleagues, some of whom are on the call today, and others conducted studies to assess the effectiveness of OSNAP as an after-school intervention. And these studies found that OSNAP can improve dietary snack consumption, particularly at sites with on-site food service. OSNAP is effective at increasing levels of vigorous physical activity. It increases children's water consumption during after-school snack time, helps after-school staff to create comprehensive written policies for improving nutrition, physical activity, and screen time in their programs. And so this is very exciting piece of OSNAP. And if you want to learn more about the actual specifics of the evidence base surrounding OSNAP, we just put a link in the chat to a page that details kind of all the specifics and all the peer-reviewed research that goes along with that. So I really encourage you to take a look at that page. I also want to highlight as well that OSNAP uses a learning collaborative model. So through the OSNAP website, which I'm going to talk about in just a moment, programs can register for a free account and sort of become part of a learning collaborative. And we also have an implementation guide available. So programs could run OSNAP on their own and work at their own pace as well. So there are those different options for going through the OSNAP program. Next slide, please. So over the past year, we have been working on completely updating our OSNAP website. It was about 10 years old or so, so it's got a totally refreshed look and feel. And we also really focused on improving the functionality as well. And so a few things I want to lift up. We have a new resource library that houses all of our materials and resources. And we wanted to give it a more simplified and updated look and feel, but we also updated all of the materials as well to reflect more current guidelines. And then we have a section as well on the website called My OSNAP. And what's really cool about it, you can create an account for free for your after school program. And you can sort of walk through the process and complete online assessments, select suggested action steps to tailor your site, get that action plan that I mentioned before, and also track your progress on your dashboard. So this is, kind of an exciting piece. And as I mentioned on the last slide, there's also a new feature in my OSNAP as well, which allows for creating sort of shared data systems for learning community managers to be able to view the progress of each program listed in their learning community. So that's kind of a new, exciting new feature that we have. Next slide, please. So one other piece of OSNAP that I really want to take the opportunity to mention, so between 2014 and 2018, our Prevention Research Center collaborated with the Boston Public Health Commission and the YMCA of the US to implement OSNAP and initiated learning collaboratives with CDC funding. And then as part of our collaboration with the Boston Public Health Commission through a project that we started in 2019, and we actually just wrapped up, the team in Boston was sort of interested in looking again at OSNAP, but more specifically into the cost effectiveness of the strategy if it were to be implemented again in Boston. And so they used their prior experience and then our approach of looking at reach, cost, and effect and cost effectiveness to provide information to sort of help their decision making. So as you can see on the slide, the results of that project show that in addition to it being a very effective intervention, it could reach nearly 11,000 children over 10 years in the city of Boston, save $34,100 in healthcare costs in the final year, the 10th year of the model. And it's also projected to be cost effective. So it's really exciting to get those additional results. And you can learn more about our cost effectiveness results in the research brief that we put together about this work. So we put a link in the chat to that as well. And overall, you can learn more about the OSNAP strategy in general in our strategy report. So that includes the projected population reach, impact on health and health equity, implementation costs, and cost effectiveness at the national level, and lots of other helpful information. So see the link in the chat as well for that information. So I'm going to turn it back to Kate to sort of close us out.
Great. Thank you, Molly. You can go to the next slide, and I'm really excited for the discussion and conversation. So just want to highlight a few more additional resources. And I've got to say, I through working with OSNAP and our relationships with the team there, I learned of this project through Choices and was so excited to see that out of school time is a strategy that you all are focused on. And those research briefs are so great. They're wonderful tools. And so I encourage you, if you haven't seen them, go check it out, and the links are there. Here's a number of other resources I wanted just to highlight. So you can see OSNAP is there, of course. And then the healthy eating and physical activity standards that I shared, you can access both the standards and then an online self-assessment tool. We ourselves have developed an assessment to action guide that helps put the HEPA standards into place. So it's a process guide to help walk through the steps of, I completed a self-assessment. What do I do next? Right? That conversation we have all the time with folks. So that guide is really intended to help walk through. Once you have an idea for an action plan, what do you do next? And then a couple other resources. I mentioned the America after 3 p.m. survey that is implemented by the After School Alliance. They have a wonderful website full of research briefs and policy briefs and information. They're a national leading organization advocating for out of school time. So I've linked to them, to our partners, the National After School Association. And then, as I mentioned, the National After School Association has state affiliates, and then there are also 50 state after school networks. So every state has an after school network. Some states have more than one. So you're fortunate, you got more supports. But so these resources will take you to learn more about those state after school networks that can really be partners in your efforts to advance health equity and thinking about engaging out of school time programs in that work. And then I wanted to also call out the Engage Every Student. This is an initiative from the Department of Education, but they're doing a wonderful job right now of providing lots of training resources and supports around out of school time. And they just hosted a webinar on chronic absenteeism that I was kind of referencing in my talking points earlier that I highly recommend checking out. Next slide, please. And then here's our website, so you can connect with us, and we'll make sure you have the link so you can access our resources and our events, and learn more about us. And then the final slide, please, my final slide. And there's my contact information. So I want to just thank you all for inviting me to join today, and I'm again really looking forward to the conversation. But just wanted to share that my email and contact information will be shared with you all, and so feel free to reach out. And I think we're going
Awesome.
to do a poll next, right, Molly?
Yeah, thank you so much, Kate. This was fantastic. Such a nice overview of out of school time, and so appreciate you sharing all those different resources. Especially, I want to give a friendly reminder to folks, if you haven't been on our coffee chats before, we always share out a resource roundup, which is just a document that includes all of the links that we've been sharing today. So if you haven't had a chance to grab the links from the chat or want to take a look at them later, no worries, we will share those out afterwards. So thanks again, Kate. Amazing presentation. And looks like Angie and our team also shared your contact information in the chat as well. So folks can feel free to grab that from there. All right. So at this time, I would like to kind of move us into our group discussion here. And so I do have some questions already for you, Kate, but I want to just say to the group, please, whatever questions you have, keep them coming in the chat, or feel free to just unmute yourself and ask. So I'll start it off with a question for you, Kate. How can folks learn more about out of school time programs in their state or community if they want to get connected or find partners?
Great, thank you. Thanks, Molly. So as I mentioned earlier, each state has a state after school network. And so, and many of them are also the National After School Association state affiliates. And that would be one of recommendations that I would encourage you to check out, regardless if you work at the local or state level, because many of them do a lot of work to map out of school time happening in the states. So they have a really wonderful, their membership organization. So they know who the members are in their state, but then they also are mapping them. And so you can really understand where out of school time is happening in your state or in your community and where there are gaps. So that is one really good resource to check out. They also all of them offer training and professional development. And so if you're looking for more training and professional development, that would be a good resource. But if you have training to offer, that would be a great partner, so that you're connecting with them to provide your training and expertise to out of school time professionals. I want to mention that there are two major federal funding sources that support out of school time. One of them is the Department of Education's 21st Century Community Learning Center programs. And I used an acronym earlier, I apologize. So 21st Century Community Learning Centers, that is the largest federal funding source for out of school time. And if you look up the Department of Ed's, if you just Googled that, you would find all of the contacts, both for the state, and you can also find all of the grantees that get funded through that 21st century. And so that's a really good resource to tap into, to understand, again, what's happening currently in your state, and where maybe there are gaps or opportunities. And then finally, as Molly introduced me, one of the things is I work on the collaborative, but I wear another hat. And I also help support the National Center on After School and Summer Enrichment, which is funded through the Office of Child Care. And childcare is a significant provider of out of school time care and is often overlooked when we talk about out of school time. And so the Child Care Development Fund is one of the second other largest funding streams for out of school time care, which is the fund that really supports working families with providing subsidy dollars for childcare. So, so again, if you're thinking about who to connect with, I want to learn more, think about the Department of Ed and the 21st Century programs, connect with your after school networks, and then also be mindful that childcare is also happening. And there's another really great partner and resource to look at and see what's happening in my community and where are some, opportunities. Maybe there's some gaps in services.
Fantastic. Thank you, Kate. All great resources. And I just want to flag, there's a link in the chat that Angie just put in there for the National After School Association. So thank you. Thanks for sharing that. So another question I have here for you, Kate. So you definitely talked about health equity in your presentation, but I would love to hear you sort of expand a little bit and talk more about how out of school time advances health equity.
Great. Yeah. Thanks, Molly. And yes, please do. I see some chats. Please do put questions in the chat. And I know we had some questions submitted in advance. One of the things about out of school time, let me just reflect real quickly. One of the things that's interesting about this work is that health equity really comes out of public health, and out of school time is kind of its own realm of work. But one of the things that out of school time does really well is that we are community partners. Like, we are embedded in the communities in which that we work. And as someone who's worked in out of school time, formerly, I was the person who was interacting with all of the families and the community members and out there, both working with schools as partners, but also working with the food bank and working with our local health agencies to provide and bring services to my program. And a lot of us are doing that. A lot of OST programs are really central key partners in a community. And I think often we don't think of ourselves as public health workers or in the realm of health equity, and that we're really working to help improve those health outcomes for the young people we serve and the families that we serve. But we're like critical key players in that space. And I think what's so interesting for me in this work that we get to do with the CDC funded project and with the collaborative is elevate that role and say, like, you are an out of school time professional, and you think about your work as a youth practitioner, but you're also doing health equity work, and you are doing public health work, and you are helping contribute to these larger impacts in a community. And so that's been really fun for us to really like help elevate that and message that. We have a resource that I didn't include, but I can share. The National After School Association publishes a magazine, like a biannually magazine. And we did one that was called the Health Equity Issue last year. And one of the out of school time professionals, quoted in there, like, I'm a health worker. And it was so great to see that advocacy and understanding the role that we can play. And the other thing I want to highlight is that folks that work in out of school time, especially those who are working in community-based organizations, more often reflect the community they work in. So they tend to have, they're working with young people of a population that they also represent. And that's just the uniqueness of OST, being so grounded in community, being grounded in the community, and really the staff coming from that community to work with the youth in those communities. And I think that's really a unique, special kind of opportunity that out of school time also provides. And the staff tend to be, not only do they represent the young people that they're working with, they also tend to be younger and are more, positioned to form those really positive relationships and bonds with young people. And again, I think it's something very unique about out of school time that sometimes isn't mentioned or, highlighted in ways. And I see there's a hands up.
Yeah. So one thing I do is I work with something called Success by Six Coalition. So and then we have identified areas that in Texas, in our county, that have a huge need for services for childcare and things like that. How could we, I guess, benefit from your services?
From our services. Yeah. So good question. So we, as a collaborative, we offer a lot of training and professional development that's free to anybody. So we have a workshop. It's funny, I didn't even put this in the slides. I can absolutely share this as a follow-up, but we have a workshop coming up that's about moving from assessment to action to put the healthy eating and physical activity standards into place. So it's really tailored for folks who are like, okay, I want to know what the HEPA standards are and I want to start using them. So that is something that's an opportunity, and all of our professional development opportunities are free and open. We also provide technical assistance. So if you are interested in learning more about how to connect with some programs because you're seeing lack of access, you can reach out to me, and that's something that we can help you with. As I keep mentioning, the National After School Association is our partner, and they're a membership network. So we're able to kind of look at communities and say, who from an AA membership network is existing in these communities to help uncover maybe some of the programs that are happening and you're just unaware of, or really recognize that there's a lack of programming. And so we can provide technical assistance to help think about what you know, what's happening in your community and what are some opportunities to bridge that gap. It's funny, I was working closely recently with the New Mexico program here, and I'm based in New Mexico, and we were looking in the community of Roswell, and oftentimes people go, well, we don't have out of school time programming. It's not happening. And, you know, and earlier I had that slide, which is like where out of school time is happening. And I shared that with her, and she's like, oh, I didn't even think of the libraries. And she called the library, and of course they're running out of school time programs. And so, you know, sometimes it's really just, you know, thinking a little bit more outside of the box of your partners and and helping kind of find those people that are already, those services are happening, those kids are getting care, who's doing that, right? And oftentimes it's family and neighbor care, right? Like, so really trying to find out where those young people are spending their time outside of the school day is usually a first step in really helping uncover where those programs are happening, because they are. And I want to mention, because I haven't said it, but another, especially for communities that are more rural, 4-H is an incredible program that runs and cooperative extension services are also doing a lot in the out of school time space. So I don't know if I highlighted that explicitly, but I did want to call attention to that, because that's another really good leading statewide youth development organization, but that has a lot of local implementation. I hope that's helpful, and feel free to reach out, Lindsay. And we also, I will say the Texas has a wonderful 21st Century Community Learning Center technical assistance partner at the state level that's doing a lot of work in Texas to support those grantees, and they do professional development. They have a wonderful website. And so again, I'd be happy to help make some introductions across the state if that's helpful.
Thank you.
Awesome. Thank you, Lindsay, for the great question. And thank you, Kate, for all the great suggestions and resources. And thank you as well before on the question of health equity. I think you really lifted up just what a great opportunity out of school time is to advance health equity. So thank you for underscoring that so much. So another question that I have here, Kate, from your perspective, what is one recommendation you would make if folks are interested in getting more involved in out of school time, especially for those who are working at state and local health agencies?
One recommendation is too difficult, but I will I will try my best. So I think I've kind of said this, and I'm going to underscore it, but I cannot underscore this more, I guess. Partnerships are so critical to this work, and I think everyone on this call knows that, and knows how important it is to collaborate. And so if you are, my recommendation would be first a check to see, are you working with any out of school time or partners either as a provider level, at a state level, a partner? Are you currently working with any? And if not, my recommendation is to go reach out and connect with an out of school time partner. And again, at the state level, there's the 21st Century Department of Education program, there's the state after school networks, there's childcare resource and referrals, there's your childcare state, licensing agency. Those are all great state partners to work with. And at the local level, really think about who in your community is delivering these program services, and reach out and make some connections. Again, as I've mentioned, there's parks and recreation, boys and girls clubs, YMCAs, 4-H's, the child care centers that are happening in most communities, but then there's also a lot of services that are happening for young people that are under the radar. So, kind of tap into what's happening. And so that'd be my first thing, ask the question, is out of school time represented in my work? And if not, how can I go connect with them?
Excellent. Thank you, Kate. I think especially since a good number, maybe the majority, I think it was, of our attendees here today are kind of looking to learn more about out of school time, hopefully get more involved. So really awesome. Thanks for underscoring the importance of partnerships there. That was really great. So question in the chat, we see a lot of schools going to a 4-day week. How will this affect after school?
Yeah, Don, good. Yeah, absolutely. So good question, Don. And I think that we had, the COVID pandemic really highlighted the role of out of school time, because when schools shut down, those out of school time programs opened up. And there's a lot of now research and resources and reports that highlight how out of school time really stepped up to provide the care for young people when schools closed. And that's going to be the same with the 4-day week. So even here in Santa Fe, New Mexico, we don't have 4-day weeks, we have 5-day, but our youth serving organizations run all day Fridays because they know that varying schools have different let out times and things like that. And so they're just running the programs a full day on Friday. And I see that as a lot across the country where those programs are offering programs when school's not in session. So they're just going to do more. Unfortunately, out of school time funding is very allocation for out of school time funding doesn't always account for that. So, again, as I mentioned, the Child Care Development Fund grants, those are usually covering for part-time care. So when we move to 4-day school days and we're not, addressing that we need a full day of care, funding is going to have to catch up to fill the void there. But it's a really important question. But I think that what we've seen, and especially through the COVID, is that when school shut down, the out of school time programs opened up, and they opened up their operating hours, and they were the ones that were still providing that care for young people.
Yeah, such an important point. Thank you for the question, Dawn, and thanks for your response, Kate. So I have another question here. This was actually submitted in advance. How can you get school district buy-in for hosting out-of-school time activities?
Yeah, and I think I highlighted this one because I think that's such a good question, and it's a tricky one. So I think that one of the things that we all have to do, and what we do as a collaborative and out of school time, is make the case for out of school time often, and having to build that buy-in so that schools who are oftentimes the ones who are holding resources that out of school time program providers are looking for can see the benefit of why they would invest in these out of school time program practices. But I think, and I kind of shared this today, the evidence is there, the case has already been made. But I think it's about then building that really true, authentic partnership and really thinking about how can out of school time programs really help the schools with achieving what they're trying to achieve, and so I've mentioned the CDC Healthy Schools grantees, and I wanted an opportunity to plug it a little bit more. So the CDC is working in 20 states, in 19 states, one tribal nation, and they're implementing the whole school, whole child, whole community framework. And I think that is a good example of this getting buy-in, because the framework around whole school, whole community, whole child is inclusive of community involvement. And so if schools are implementing the framework and thinking about community involvement, out of school time partners lend themselves to be, part of that effort. And there's within the grant and within the whole school, whole communities, whole framework is this idea of really having community partners involved in the school health wellness councils or coalitions. They're called all different things, but that district and local education agency and the district wide, those school health initiatives that are happening to really engage community partners. And to me, I see that as a really good opportunity to build that buy-in and get that conversation going and build that authentic relationship and partnership. So I do want to say too, we'll share the link, but if you are working at a state level and you're interested in to learn more about the whole school, whole community, whole child framework, or the CDC Healthy Schools, again, I can help make those connections and provide that technical assistance to be the bridge to make those relationships if you're interested in learning more. But then, like I said, at a school level, at a local level, looking at those, what are this local wellness school-based, coalitions doing? How do I get involved? Is there an opportunity? And that's a call to all of you in the roles that you all play. Like, that's a really great opportunity. If you're not involved in a district-wide health initiative, that might be a really good opportunity, regardless if you're working at out of school time, but thinking about that kind of school connection.
Great. Thank you, Kate. Such a great point there. Really appreciate that, and want to flag there's a link in the chat as well to the whole school,
Oh,
whole
great.
child
Thank you.
framework. So again, we'll share that out as well. But these have been fantastic questions. So thank you folks for all the great questions, and Kate for your wonderful responses and resources. I think if we can pull up our last slide here, I'll just share a couple of few more points, and then we'll be finishing up for the day. So I want to remind folks that we are always accepting suggestions for topics for future coffee chats. So please do share those. You can put them in the chat or send us an email. We're always looking for your thoughts on what you want to hear about next. Always like to remind you, we have more resources available, as well as a library of all of our previous coffee chats and a member directory in our community of practice portal. So you can register to join. It's free to join at the link on the slide there. We'll put that in the chat as well. And I'd also like to mention there'll be a little post-event survey that will be showing up on your screens when you leave the event today. We really welcome your feedback, and very appreciative of folks taking the time to complete that. Should take just a minute or two. Again, want to remind you, we will be sharing the recording of today's session and all of the amazing resources that have been shared. And Kate's contact information, she's just put in the chat, but we'll share it again as well. So be on the lookout for that. We'll share the slides too. I think with that, I really just want to thank Kate so much for your time today and the wealth of information that you've shared about all the amazing work that you're doing in out of school time and that folks can get engaged in. So thank you so much, Kate. And thanks to all of you all for joining us this afternoon. Hope you have a wonderful Halloween.